Antibiotics are miracle drugs that can save lives by fighting off bacterial infections. But what happens when these powerful medications no longer work? Today, we're diving deep into the alarming rise of superbugs, specifically multi-drug-resistant bacteria. These microscopic villains are not just a threat in hospitals. They're also making their presence felt in nursing homes and even in our own homes. The situation is more serious than you might think. So get ready to learn how these bacteria evolve, how they spread, the health risks they pose, and most importantly, what you can do to safeguard yourself and your loved ones. By the end of this video, you'll have all the knowledge you need to protect yourself against these silent enemies. Just stay with me till the end. Trust me, the knowledge you will gain could be life-saving. Let's get started. What are multi-drug-resistant bacteria? Imagine a microscopic battle between antibiotics and bacteria. Antibiotics are the weapons designed to destroy harmful bacteria, but some bacteria have developed armor, making them resistant to multiple antibiotics. These resilient bacteria are known as multi-drug-resistant bacteria. They are the villains of the microscopic world, capable of surviving the very drugs that were meant to eliminate them. But how do they develop this resistance? You might think of it as a sort of biological superpower. Bacteria, like all living things, evolve over time. When exposed to antibiotics, most bacteria die. However, some may carry genetic mutations that make them less vulnerable. These survivors pass on their toughened genes, making future generations more resistant. Over time, this process can lead to multi-drug-resistant bacteria, a nightmare for healthcare professionals and a growing concern in our everyday lives. How do multi-drug-resistant bacteria spread? Picture this: a hospital room, a nursing home, or even your own home. These bacteria can lurk in many places. Hospitals and nursing homes are often hotspots due to the high number of patients who may already be battling health issues, making them more susceptible to infections. For example, beds, toilets, bed rails, IV poles, and door handles can become contaminated. The constant flow of patients, visitors, and healthcare workers can facilitate the spread. In your home, surfaces like bathroom fixtures, kitchen sinks, and cutting boards can also harbor these bacteria. Additionally, contact with pets, especially reptiles, can introduce certain resistant bacteria. And let's not forget about travel. Coming back from a trip, you might unknowingly bring home souvenir bacteria from other countries where antibiotic usage might be different. Now that we know where they hang out, let's talk about how they infiltrate our bodies. It's easier than you might think. Direct contact with contaminated surfaces, objects, or fluids is one way. Healthcare settings use invasive devices like catheters or ventilators that can provide entry points. Even our own hands can carry these bacteria. In healthcare settings, it's not uncommon for staff to inadvertently transfer bacteria from one patient to another through equipment or by touching surfaces. And we're not immune either. We can pick up resistant bacteria from our surroundings, especially in healthcare facilities or after extensive travel. Once inside our bodies, these bacteria can multiply rapidly, leading to infections. The scariest part, they might lie dormant for a while, only to strike when our defenses are low, like when we're sick or on medication. What do multi-drug-resistant bacteria do to the body? Imagine a microscopic attack happening within your body. Multi-drug-resistant bacteria can cause a range of infections, from minor skin irritations to life-threatening conditions. Urinary tract infections are common, especially in elderly individuals, causing discomfort and potential kidney complications. Pneumonia can be particularly dangerous, especially for those with underlying health conditions. Sepsis, a severe whole-body response to infection, is a terrifying possibility where the infection can spread through the bloodstream, overwhelming the body's defenses. Resistant bacteria can also lead to persistent wound or bed sore infections, hindering the healing process and potentially leading to limb amputation in severe cases. Meningitis, an infection of the membranes surrounding the brain and spinal cord, is another serious concern. Finally, these bacteria can trigger severe diarrhea, a risk often associated with antibiotic use, such as Clostridium difficile. Let's take a closer look at some of the most common multi-drug-resistant bacteria and the infections they cause. First, we have Enterococcus faecium, commonly known as VRE. This bacterium can cause urinary tract infections, wound infections, bloodstream infections, and even meningitis. Streptococcus pneumonia, also known as pneumococcus, is another major culprit. This bacteria can lead to pneumonia, meningitis, and sepsis. Staphylococcus aureus, including the notorious MRSA strain, is infamous for causing skin infections, pneumonia, and even life-threatening conditions. Pseudomonas aeruginosa is a bacteria that thrives in moist environments, often causing lung infections, especially in individuals with cystic fibrosis. And then we have Klebsiella pneumonia, which can cause pneumonia, urinary tract infections, and bloodstream infections. These are just a few examples. There are many more multi-drug-resistant bacteria lurking, waiting to exploit any weakness. How do we protect ourselves from multi-drug-resistant bacteria? Prevention is our first line of defense against multi-drug-resistant bacteria. Here are some essential steps to keep you and your loved ones safe. Hand hygiene is paramount. Regular hand washing with soap and water or using hand sanitizer can significantly reduce the risk of transmission. Wearing gloves when handling contaminated materials, whether in a healthcare setting or at home, is crucial. Ensuring surfaces, especially in restrooms and kitchens, are cleaned and disinfected regularly can prevent the spread of bacteria. Not sharing personal items like towels or utensils can also be helpful. Taking antibiotics only when necessary and completing the full course as prescribed can hinder the development of antibiotic resistance. Changing wound dressings with clean hands or gloves is important to prevent infections. And lastly, consider wearing a mask and gloves when visiting infected patients or in healthcare settings if recommended. By following these preventive measures, we can create a safer environment for ourselves and those around us, reducing the risk of encountering these resilient microbes. I've shared some ways to prevent infection, but what should you do if you suspect you have a multi-drug-resistant bacteria infection? Early detection and treatment are crucial. Be vigilant about unusual symptoms, and don't hesitate to seek medical advice. If you're in a healthcare facility, inform the staff about any recent travel or potential exposure to infections. Accurate diagnosis is essential and may involve tests like blood cultures or urine analysis. Treatment often involves intravenous antibiotics, but due to resistance, finding the right antibiotic can be challenging. Hospital stays might be necessary for monitoring and treatment. In some cases, specialized labs can help identify the specific bacteria and its resistance patterns, guiding doctors in selecting the best antibiotics. Recovery can be lengthy, and physical therapy might be needed if complications arise from treatments like dialysis or respiratory support. The challenge lies in balancing treatment risks, like further infection, with the benefits of tackling the resistant bacteria. The good news is that awareness of multi-drug-resistant bacteria is growing, leading to better reporting, tracking, and prevention strategies. Staying informed, practicing good hygiene, and being proactive about your health are essential. Together, we can combat the spread of these resilient microbes. This video has been a deep dive into the world of multi-drug-resistant bacteria, a topic that's vital for everyone, whether you're a healthcare provider, a patient, or simply someone concerned about your health and well-being. As we come to the end of our discussion, remember that knowledge is power. Understanding what multi-drug-resistant bacteria are, how they spread, the health risks they pose, and how to protect yourself is crucial in this ongoing battle. Let's take a moment to recap the key takeaways from our conversation. First, we've learned that multi-drug-resistant bacteria are tough opponents. They've evolved to survive the effects of antibiotics, which are commonly used to fight bacterial infections. Their resistance can be traced back to genetic mutations that allow them to withstand the drugs designed to eliminate them. Next, we've explored how these bacteria spread. They're not picky about their mode of transportation. They can hitchhike on surfaces, medical equipment, hands, and even pets. Healthcare settings and poorly ventilated spaces can become breeding grounds for these microbes, making vigilance all the more important. We've also examined the health risks posed by multi-drug-resistant bacteria. From urinary tract infections to pneumonia, sepsis, wound infections, and meningitis, these bacteria are a serious threat. It's crucial to be aware of the symptoms and seek medical help promptly. Early detection and treatment can make all the difference in preventing more severe complications. Finally, we've discussed ways to protect ourselves against multi-drug-resistant bacteria. Prevention is key. Practicing good hygiene, being cautious in public areas, using protective gear when necessary, and following medical advice are all critical steps. By understanding the enemy and knowing how to defend ourselves, we can navigate this challenge more effectively. As we conclude this video, remember that multi-drug-resistant bacteria are a growing concern, but not an insurmountable one. Stay curious. Keep learning, and don't hesitate to ask questions. Your health and well-being are in your hands. And with knowledge, you have the power to make informed decisions and take proactive steps towards a healthier, safer life. If you found this information useful, please show your support by giving this video a thumbs up. Subscribe to my channel and click the notification bell to get notified about future content. Sharing this knowledge can help keep communities safe. Until next time, stay healthy, stay informed, and stay strong. I'm here to empower you on your health and wellness journey.